pleasure to have you join us today on the program Healthy Living. I am Adesuwa Usa Uwage. A man who is healthy is definitely the one who is wealthy. Let us not take our health for granted. If you sense anything at all, I think you should see a doctor. That is the way it works. That is the way it operates. Forget about this myth that, so many myths going around when it comes to your health issues. Okay, but I think the one you should do is to see a doctor. There is no point in delaying. It is better a doctor, a qualified one, certified you free than you taking medications by yourself or listening to people talk. And so that is the purpose of the program Healthy Living. And we also give you a chance to talk to a doctor. The only thing the doctor will not do is recommend drugs for you. We don't do drugs on the program, okay? But whatever question you have, ask a doctor. Today we're going to be looking at infertility. What infertility is, causes of infertility, and of course how to manage it if time will permit us. Otherwise, we'll take it one step after the other. And you will call us if you call this number 052-290-573. That's our call line. And we also do WhatsApp on this program. And if you want to send any message, ask any question, please do that on 070-8734-1599. Join me as I welcome my guest, Dr. Ogbonwa. It's nice to have you join me, Doctor.
It's a pleasure to be with you today.
Okay, so Doctor, as a specialist in this matter we're talking about, what is infertility?
Infertility simply means inability to achieve a pregnancy, a conception, for a period of 12 calendar months of unprotected intercourse.
Okay.
But nowadays, we have revised that WHO definition from 12 calendar months of unprotected intercourse in two people who are healthy, in inverted commas, to include, a period of 6 months for those who are above 35 years of age, or a period of 6 months for those who have other associated problems to infertility. If a man has abnormal semen count and he's been trying for 6 months, there is no need to wait for 12 months. The onus is on the doctor or the attending physician to commence investigation. So, broadly speaking, infertility is inability, one, to achieve a conception, two, inability to carry pregnancy to term, subfertility. Those women who come under this category are those who get pregnant, they miss their period, they do a pregnancy test, it's positive, but in 2 to 3 months, there's a miscarriage. The pregnancy does not grow. They lack the ability to carry the pregnancy to term. So the sum total of all this we regard as subfertility.
Okay, so infertility and sterility, are they one and the same?
No. When you're sterile, it means that you lack the ability to produce those garments that are required to facilitate a conception. For example, if you are a male, you are not able to produce, spermatozoa, or you are completely azoospermic. Azoospermic means you do not have, spermatozoa that can achieve a fertilization.
Okay.
In the case of the female, when they lack ovary that will produce the human oocyte that will be involved in fertilization. So you say they are sterile. But when you are fertile, you can achieve this. When you are infertile, you are unable to achieve this. But strictly speaking, the committee of those, managing subfertile couple have come with a terminology of referring to these women as being subfertile.
Okay.
All women are fertile. They are only infertile if you lack the ability to treat them and ensure their fertility. So in a particular place, they might lack the ability to investigate, to determine the cause of the problem and deal with it. But in another client, they will have the facility to detect and deal with such problems So in that situation, the person who you may regard in one situation as completely infertile, in another situation is subfertile, because the facilities to make that individual achieve a pregnancy and carry the pregnancy to term are available.
Okay. Now, let's look at infertility in men. Let's take it one after the other. Okay. Infertility in men. Yes. What are the causes of infertility in men?
Well, the causes of infertility in men are varied. It can be from their lifestyle, lifestyle involving things like using tight pants, reducing sperm count, hot baths that reduces sperm count.
Hot baths?
Yes, all because the way God is a wonderful architect. You see the way he created the human body, he kept the testicle outside to maintain a lower body temperature. Whereas in Homo sapiens, the temperature ranges between 36 and the low 37. But at the level of the scrotum, you are looking at the temperature of about 35 to 36, which is optimum for the production of spermatozoa. That's one aspect. Male can be subfertile right from when they were born as a result of their chromosomal content. They may have inappropriate chromosome. Where they are supposed to have an SY chromosome, they may have SSY or SSSY, which predisposes them to lack the ability to produce appropriate spermatozoa to effect, a conception. So it might be a chromosomal genetic level. Beyond that, there can be problems like surgical intervention. A child might be riding a bicycle and injure himself as a result of testicular torsion. So the pipe that carries the spermatozoa that has been produced in the testicle through the vas deferens into the urethra or where it's ejaculated, that passage is distorted. So spermatozoa that are produced do not get to where they are required, and that can be a cause of infertility in the male. All right. There are situations where a male gets an infection that ends up in urethral stricture. Stricture means there's narrowing of the urethra through which the urine passes. The person will lack the ability to pass urine, or he will pass urine in drop, or the individual will have what we call overflow incontinence. So in that situation, the individual will be unable to achieve ejaculation. And when there is no ejaculation, then there is no spermatozoa that can go on and fertilize. But there are other surgical conditions where somebody has got a hernia or a hydrocele and he goes to a surgeon, and inadvertently the spermatic cord is severed and it's unknown to the surgeon. If it is known, then they can do what they call a re-rolling and anastomose the two severed ends. Okay. But in certain situations, it may not be a direct, complete cut. The vas deferens may be crushed, in which case there's continuity, but the pipe inside is blocked. Also, infections like chlamydia, Neisseria gonorrhea, syphilis can also do this. In all among these bacterial organisms, chlamydia is the most horrible because it does things very silently. Whereas gonorrhea will give a male, a lot of pain, a lot of urethral discharge that's offensive, and because of this, he will quickly seek the attention of a physician. But in case of chlamydia, it's very silent, and he may not.
So how does the chlamydia work? What are the symptoms?
The symptoms are very minimum. All you need to do is to do an immunoassay. You cannot really culture it. You take a swab and do an immunoassay and see if the individual has already developed antibodies to chlamydia. So they do it in the lab. It's always good to check because it's a silent destroyer. Not only in the males, but also in the females.
We live in an environment where most people don't like to go to the hospital until they are down and almost out.
Yeah, it's very unfortunate.
So how can a man go to the hospital and check and say, I need to check for this?
You see, people should take their health seriously. When you get to a certain age, it is pertinent. It is very important that at least once in 12 calendar months, you go for a checkup. Checkup means check your blood pressure, your urinary output, your sugar level, the kind of protein in your urine, whether there's damage to the kidney. You check your heart, you do an ECG. It doesn't cost much. Then you just ensure, these things are working rightly.
Okay. So let's look at causes of infertility in women.
Yeah. Causes of infertility in women, you can also start from the chromosomal level, where women lack, the two X that make a woman a woman. So instead of having two X, they can have one X, an XO, and they will have what we call streak ovaries. And streak ovaries are unable to produce, eggs. And if they are unable to produce eggs, they are unable to ovulate. So those are problems with ovulation. Okay. Some other group of women, they have ovaries, but these ovaries are polycystic. And in certain situations, they develop polycystic ovarian disease or polycystic ovary syndrome. And there are all other telltales associated with this condition. And when this occurs, the doctors who is familiar with this disease is able to detect it and treat them appropriately. So this kind of condition results in anovulation. A woman, instead of having about 11 cycles in 12 calendar months, we have only maybe 3 or 4 cycles. And those cycles where he is not, ovulating, where she is not ovulating, result in anovulation, and during those cycles, she is unable to produce, the required human oocyte that will be involved in fertilization and subsequent, pregnancy. Those are problems. So you look at the human being. The way when I'm discussing with patients, I just tell them, one, you have an egg. Are you producing egg? That's the ovulation. The second thing, is there a passage from the ovary, to where fertilization can take place? Are your tubes open? Have you been exposed to infection like the one we just discussed, chlamydia, syphilis, and any other of like Neisseria gonorrhea that can damage the tubes? Conditions that are associated with adhesions, conditions like endometriosis. In endometriosis, the tubes, they can become kinked as it is. Apart from kinking, they become hardened. They are unable to carry out their functions. And when they are unable to carry out their functions, fertilization cannot take place. In certain situations, fertilization can still take place, but the fertilized, human oocyte that creates the embryo cannot move from the point of fertilization into the womb. So it ends up as an ectopic pregnancy. Okay. Ectopic means out of the appropriate place. Yes. The ectopic pregnancy can be in the tube, can be in the fimbrial end or the ischial end or the ampullary region, or it can be in the cervical canal. So all these are problems that are associated with soft fertility. Person has been able to produce an egg, spermatozoa has been able to travel to meet and ensure a fertilization, but unfortunately the process is so incomplete because the moving motion, the peristaltic motion of the tubes do not take place, and it stops by the wayside and develops into an ectopic gestation. So all those also are problems. Then we have problems within the uterus. Problems in the uterus are that the uterus can be developmentally abnormal, anatomically abnormal, as a result of congenital malformation or as a result of the drug ingested by the mother during organogenesis. Organogenesis simply means during the time these organs, the uterus, the heart, and the liver, and the kidneys are being formed. So if you take drugs that are injurious to this development, they will interfere with the development of these vital organs, and these vital organs will not be produced, and that will affect the individual subsequently.
So when a woman is
you should
pregnant,
not take medicine anyhow, just medicine, in your early pregnancy. The first 8 weeks is very critical, very, very critical of taking, inappropriate drugs, hormones in particular, that can result in problems. So all these are predisposing to causes of the infertility or subfertility, as the case may be. So that's the level of the uterus. Then if you go lower down, at the level of the cervix, the cervix plays a paramount role in producing the strings. It's like a ladder. This is what the spermatozoa latches on. There are strings, of the mucus coming from the cervix that facilitates the movement of the spermatozoa through the cervical canal into the endometrial lining, subsequently to get into the fallopian tube. If you've done damage to the cervix as a result of repeated termination of pregnancy because of cervical dilatation with dilators, because these things are forcibly done, in backroom abortion clinics, then that will predispose to subfertility. Also, if you are in a country where you have, an organized cervical screening program, then in certain situations you have, what we call moderate to severe dyskaryosis. Then you have a cone biopsy or carcinoma in situ on the cervix. You have a cone biopsy where that mucus producing part of the cervix is removed. Then the individual may end up with subfertility. And even in certain situations, those strings might still be present. Person will achieve a pregnancy, but because the neck of the womb is weakened as a result of that treatment, the woman is unable to carry the pregnancy to term. Then she will just tell you, nothing happened to me. I just woke up from sleep. I was just going to the toilet. Then the baby just came out with the water and everything. So because there is cervical incompetence. So when it happens once, the doctors or gynecologists are given that history, they ensure that it does not happen the second time by putting the prophylactic, cervical cyclage or chirurgical stitch, as the case may be, so that it does not happen. We do it earlier, in subsequent pregnancy from 14 weeks.
Okay. All right. If you're just joining us, the program is Healthy Living on independent television. And I'm speaking with Dr. E. Ogboma. He's a consultant gynecologist and medical director, Gable End Hospital. And we are looking at infertility. Okay, we have a call. Hello, caller. Hello, caller. Hello, we can hear you. Tell us your name. All right.
I want to ask doctors a question.
Okay, go ahead. Doctor is listening.
Okay, I want to know, a woman who has a fibroid,
Yes.
and a woman is about 41 years old,
Yes.
with multiple fibroids,
Yes.
and that she has gone for several places for tests and received solution. Can she be able to get pregnant?
Okay, doctor, you heard that
Yes,
question?
a woman with a fibroid can achieve a pregnancy. The question is, can she carry the pregnancy to term? The thing about the fibroid is that, where is the location of that fibroid? Is the fibroid within the muscle when we say it's a myometrial fibroid? Or the fibroid is submucous, in which case it's just lining within the uterine cavity, or is subserous. If the fibroid is on the outside of the womb, it will have no effect, minimum or no effect whatsoever. Yeah?
Hello, caller. We didn't hear that.
I said, it's you tell me.
Please reduce the audio level on your device.
Okay, thank you.
All right, I guess that caller is off. Well, if you're just... Okay, caller, ask the question again, please.
I said, it's
All right, please call us back and endeavor to always turn down the audio level on your device, whether your television set, if you're watching us online, whichever way you're watching us with, whichever device you're watching us with, just turn down the audio level so that we can hear you properly. Dr. Stephen Ogboma is here with me, and we're looking at infertility, both in men and women, because most often the time you hear men say they are very fertile. This is not a problem in their family. They have brothers who have given birth, they are father and all things, so it's usually the woman's problem. So we need you to really emphasize on the need for a man to go check in the hospital to see whether he is fertile or not, because it's a woman's thing.
The truth is, it takes two to tango. It takes a man and a woman to produce a baby. So if there is a problem, it's not always the woman's problem, it can be the man's problem. Infertility is a couple thing, man and woman. So when I see patient, I see man and woman. I don't like to see the woman alone in my clinic, because if you don't have a husband or a partner, then you should not be seeking a baby. You must come with your husband or your partner. There are male factors. For 40% of cases of fertility is due to males, and about 40% due to females. So that's 80% already. Then you have 10% about unknown, and another 10% due to the man and the woman together. That's a rough WHO classification of causes of fertility. So it is not right for any man to say, oh, it is not my problem, it's the woman's problem. Mm-hmm. It's not the woman's problem, it's a couple problem. So when a family lack the ability to achieve a pregnancy and produce a baby, then they should tackle it together. Both of them should see their doctor for help. Okay. Because both of them are involved in the production of a baby.
All right, we have our phone numbers on the screen there, 052-290-573 for calls only. And WhatsApp only is on 070-873-41599. And we are talking about infertility. So whatever question you want to ask, please let it be around this topic of discuss. Dr. Stephen Ogboma is very much here. We want to do a very short break, and when we come back, we will entertain all your questions. So stay tuned and don't touch that dial.
Oh yes, it's the 2018 World Cup. 32 countries in 32 days will slug it out in 11 venues in one country at Russia 2018 World Cup on June 14 to July 15, 2018. Independent Television presents 2018 World Cup Countdown Live Show with Comrade Emerson. Get the latest team news, players' profiles, the thrills and frills heralding the 2018 World Cup every Wednesday on Independent Television World Cup Live Countdown Show with Comrade Emerson. This is 1 hour of unlimited sportstainment powered by Independent Television. This event is proudly sponsored by Global Horn Industry Limited, manufacturers of quality PVC ceilings with choice colors and importer of security doors, Kilometer 10 Benin Sapler Road by the Benin Bypass, Benin City. Asagba Mobile Phone World, dealers of mobile devices such as iPhone, Samsung, Infinix, Tecno, Fero, plus repairs of mobile devices at Omegatron Plaza, 47 Airport Road, Benin City. This event is supported by Brightons Electronics Company International Limited, manufacturer of Brightons Inverters, Brightons Alternator Boosters, 30 Federal Government Guest College Road, Bowo, Benin City. Fresh Mobile Niger, dealers of phones ranging from Tecno, Gioni, Infinix, iPhones, and lots more, laptops and accessories, 119 Upper Mission Road, opposite UBA, Benin City. EDS Paints and Building Accessories, Kilometer 12, Benin Sapler Road by Orege Community, Benin City. Mr. Erosa Agbonifo, Managing Director and Chief Executive Officer, ETEC Global Limited, 64 Airport Road, Benin City. Senator Pharmacist Matthew Rokide, Senator representing Edo South Central District and Chairman Senate Committee on Public Accounts. For other advert placement and inquiries, please call the following number: 0802 3420 715, 0703 5278 527, or the commercial department, ITV Radio, Glasshouse Airport Road, on 0708 365 2474.
All right. Thank you so much for joining us again on the program. And I have Dr. Stephen Ogboma, consultant gynecologist and medical director, Gable End Hospital. And we're looking at infertility, causes, and management. Well, Dr. Stephen, while we were discussing, you talked about weakness of the neck of the womb.
Yes.
And I know a lot of people will be wondering, what has that got to do with what we are discussing?
Yeah.
Weakness of the neck of the womb.
When we made the definition of subfertility, we didn't say that in addition to the inability to achieve a conception, we included inability to carry a pregnancy to term. What happens when the neck of the womb is weak is that pregnancy cannot get to term. A pregnancy that ends at 14, 16, 18, or 22 weeks is not viable by law. In Nigeria, at 28 weeks. In other countries, at 24 weeks before you say a pregnancy is viable. So when you have a late miscarriage like that, as a result of weakness of the tube, of the neck of the womb, then that pregnancy did not reach viability, and that individual can be described as subfertile. There are causes of this weakness of the neck of the womb. It can just be the inherent collagen, the collagen weakness in that individual. So we all have collagen that result in the tensile strength of our muscles and fibers, but in certain situations they are weak. They are not able to hold on when they are carrying a subsequent weight. You see, if I say carry a weight of 10 kg, you can hold it, but for how long? If you have to carry it for 10 minutes, your hand may not be weak. By the time you carry that same 10 kg for an hour, your hands are weak, and it gives way, you just drop the 10 kg weight. So also is the neck of the womb. When the baby is growing and the weight is increasing and the tensile strength of the neck of the womb is inadequate, it gives way. Then the baby and the baby water just come, and the individual is said to have a late miscarriage. Okay, that's one. Two, in certain situations, women, especially young girls, they go and use termination of pregnancy as a method of contraception, which should not be, because there are very effective methods of contraception that are valuable and are quite cheap. So during these processes of termination of pregnancy, the neck of the womb is forcibly dilated with iron dilators, and this destroys the inherent collagen and the tensile strength of the neck of the womb. So when there is a baby inside, as the weight of the baby increases, the neck of the womb cannot hold, it gives way. The third cause that we are also very familiar with is following treatment for cervical intraepithelial neoplasia, we call it CIN2, moderate dyskaryosis, or CIN3, which is called severe dyskaryosis. So this occurs where people screen for cervical cancer. In this country, we don't really screen, in the call and recall system for cervical carcinoma, but people just do it opportunistically when they go into a clinic where they have a colposcopy service being rendered. Okay. So if the neck of the womb, in the process of treating severe dyskaryosis or moderate dyskaryosis, then the neck of the womb is interfered with, then that neck of the womb is tampered and cannot carry a pregnancy to term. So this can happen, can be associated with subfertility as a result of removing the cervical mucus. It can become associated with subfertility as a result of inability to carry pregnancy to term. So
how do we manage it?
Management is by putting a string. If a woman gives a history, I was pregnant when I was 18 weeks, the baby just came, Nothing happened. I didn't bleed. I didn't lose water. It just happened. When I just got up from bed, everything just came. So you know that she has a weakened cervix.
All right.
In subsequent pregnancy,
yeah.
you put a cerclage. Cerclage can be McDonald's stitch or it can be Shirodka stitch. Whichever is good, do the one you are able to do, and you know that will keep the baby in his place.
Okay. So when do you take it out?
You take it out after 36 weeks.
After 36 weeks.
Yes.
Okay, while we were talking, a message came in that, well, the woman says she's been married for 10 years, and the doctor confirmed her fertile, but did nothing happened. But for the past week or so, she's been having this kind of pain on her left side, and she's wondering what could be the cause of that.
Okay, if you see, there are unexplained infertility. When doctors examine you, they carry out their tests, and they can't find any pathology. Okay. They will say everything is fine. But there might be some unknown causes which we are unable to test for at this point of discussion. So the pain the woman may have had, she said she's 35 years. She's still ovulating.
No, she's been married for 10 years. She didn't state her age.
Yeah, she's been married for 10 years. So pain on one side can be ovulatory pain. Okay. It can be pain as a result of endometriosis. It can be mid-cycle pain. It can be of any origin.
So what's your advice to this woman now?
My advice is for her to see a gynecologist.
Okay.
And for reassessment. She has been assessed.
Yeah.
Then go for a reassessment.
Okay.
Do more tests and see how things go.
We have another question here. I'm a lady of 40. Yes, I did a pelvic scan before, and I was diagnosed to have ovarian cyst. What are the health implications? Besides, I noticed things like balls on her breasts. Please, what can I do? What can be done?
Okay, just to let you know that ovarian cyst is not, I repeat, not associated with boils on the breast.
Okay.
Well, the ovarian cyst, was it a single cyst? If it's a single cyst, it may not interfere with your ability to release egg every month. Was it on one ovary or it was on both ovaries? Were there several cysts? In which case we are dealing with a case of polycystic ovary disease. But one single cyst cannot account for subfertility. Okay. If that single cyst is there, that single cyst can be removed and the woman can go on to have pregnancy. All
right, this other one says, Doctor, she says she has not given birth before, but her husband went out and now has 2 sons, and doctor said she is okay. What could be the problem from Osas?
Well,
she's been married, no kid, but the husband went out, he's got kid for himself, and the doctors confirmed her fit, so yet
it's an unfortunate situation to be in. But, well, there are things I could say, I would want to say it. The thing is, if your husband is able to achieve a pregnancy from another woman, there might just be one, at hormonal level, there might be problems between you and your husband. You may have developed antibodies against your husband, spermatozoa, as the case may be. Or you may have other causes that produces antibodies in your system, antibodies that we can check for in this country now that may be responsible for you not to achieve a pregnancy with a particular man. And whereas when this man goes to another woman who does not share similar antibodies with, then the woman can get a pregnancy. Until you do DNA and be very certain of who the parentage of a baby is, you can never be 100% sure of who the father really is.
Okay, doctor, let us look at this one. The woman says she's pregnant, but yet she gets discharged.
Yes, in pregnancy, your body, the estrogen level is quite high, and you have a lot of secretion. But the secretion should be plain. When you have catarrh, that slimy stuff, or the white of an egg, I don't mean the white part, the colorless part of the egg that draws. That's the kind of discharge, that you should have. It's not associated with infection. this increases in pregnancy. Okay. And sometimes, because of the pressure on the bladder, some women lose a little bit of urine that can mix with all this discharge. But in that situation, there is an ammoniacal smell, the smell of urine around the woman. And when she enters your consulting room, you'll be able to say, well, she's leaking urine, you know, in spite of pregnancy.
Nothing can be done for that, about that?
Yeah, we just to ask her to have, you know, good toileting and good personal hygiene. Okay. That's all.
All right, doctor, what has age got to do with, okay, before that, let's look at this. The ovarian is low after carrying out all tests in HRP, that's UPTH, and my husband's, motility is nil.
Yeah.
Okay, the dead ones are more than the live ones. They placed us on drugs, yet no result. So they asked us to go for IUI or IVF. What do we do?
Okay, the thing is that it's unfortunate again to have abnormal semen analysis report. This is an abnormal semen analysis report. Okay. The number of spermatozoa that are dead are quite large, although they didn't give the percentage. He said there are more dead cells than living cells. But it's not enough for the cells to be, for the spermatozoa to be living. They should have the capacity to be mobile. The motility is very important. That's the strength, the motility, and the morphology. How do they look? Do they have head? Do they have tails? Are they tailless? You know, so all this determines.
All right, can ovarian cyst...
Giving the treatment suggested, IUI, I don't think would be very helpful. The best treatment for this kind of patient is to do what we call intracytoplasmic sperm injection. And an embryologist will look at all the spermatozoa under the microscope and pick the best and use this for ICSI, and that woman can achieve a pregnancy. IUI, the result is very poor, less than 5%. So if you do 100, only about 5 people will get pregnant. It's not very effective.
So can ovarian cyst cause infertility? Ovarian cyst and PID. What is PID?
Yeah, pelvic inflammatory disease is associated with PID, yes. And we're discussing bacterial infection and all that. Yes. Bacterial infection, Neisseria, gonorrhea, chlamydia, they lead to PID. You know, we tend not to use all these words so that we don't confuse people. Yes, it can cause PID, it can cause subfertility as a result of adhesion. The tubes can be kinked, the ovary can be buried in adhesions. Even if the ovaries are releasing eggs, they're unable to transverse, to get through the tube to a point where the human oocyte can be fertilized and subsequently achieve conception, which is unfortunate.
All right, Dr. Stephen Ogboma, what is the role of age in fertility?
Yes, there is an inverse relationship between age and fertility. As the age rises, fertility drops. This is known, it's been proven beyond reasonable doubt. So it's good for our women, especially those who are very educational inclined or those who are very career inclined, to take a gap and make their babies. Just make 2, 3, or 4 babies and stop, then continue with your career. Okay. So after a long debate in a meeting somewhere in Europe, the agreement was that, you know, if you just get married, just have your babies. You'll just have them one after the other. Then you stop, then you can pursue your career. The idea of waiting till you are 37 or 40 before you are looking for a baby is difficult, because IVF is not a panacea. It does not solve all the problems. There are quite a lot of people that have done repeated IVF cycles, 10, 12, 15, yet they are not able to carry home a baby. So these are issues. Although the science is there, but it's not 100%. IVF, as we speak, does not cater for every woman. So in the best centers, it's 4 out of 10, 2 out of 5. If you treat 5 people, it's only 2 of them that will be happy and go home with a baby. Others, one may have what we call a clinical pregnancy. Clinical pregnancy is that you do a pregnancy test, it's positive, but you do not carry a baby home. So that's not what you want. You want to hold the baby in your hand, a baby that will put the smile back on your face. Unfortunately, it does not happen. So IVF is not the panacea. Don't wait. Do it according to as God has said. make your babies when you are young. Because when you get older, it becomes difficult. The relationship is an inverse relationship. As age rises, fertility drops.
Okay, I'll ask you a question just after this. I don't ovulate every month. What do I do to boost my ovulation? To boost my ovulation, rather.
Well, you see your doctor.
Okay.
What can be done in that situation is that they can do what we call follicle tracking. They give you some medicine, they follow it up, we repeat ultrasound scan, and watch the egg growing. And when it's time for the egg to be released, they tell you, to meet, or somebody will do an intrauterine insemination at that time. And the likelihood of achieving a pregnancy is very high. So that is a managed cycle. So people should try and have managed cycle instead of just going to the chemist and buying ovulation stimulating drugs and just take it on their own. It's not enough.
Okay. All right. So we were talking about age, and you said the more the age rises, fertility drops. So what is the best age for a woman to make babies? The
22.
best age? 22.
Yes.
And we peg it at what
age? The best obstetric performance is at the age of 22.
22 till what age?
As you now go up, as the age rises, that good level drops.
Okay.
So by 35, you should have made your babies. It's not at 35 you will be looking for a baby, because it's getting late. Number one, there is scarring in the ovary. The ovaries become atretic. They are weak. They are now made of fibrous tissue. God endows every woman with about 500,000 eggs, and every month a few of them will want to develop to become a baby, and not all of them will get there. Some of them will die on the way, and maybe one or two that will be released and subsequently be involved in conception. So as the age goes by, the ovarian capital drops. Okay. And that affects outcome of achieving a pregnancy.
All right, the program is still on, and our phone numbers are very much alive. So give us a call on 052290573. The doctor is here, and he wants to answer all of your questions. And WhatsApp only on 070-873-41599. Doctor, let us look at management of infertility. How effective is this in our world today, with all the medicine, with all the gadgets, everything available?
Yeah, I would say management of infertility is very effective. Science has gone, taking leap strides, and where women can just stay without a baby, it's very possible for them to achieve a pregnancy now. We are able to do, microsurgery to get some of the tubes repaired, and we are able to do tuber transplant. We are able to do, uterine transplant, but the results are minimum, but they are possible. But what has gained popularity around the whole world, by WHO standard, nearly 165,000 babies have been made since Louis Brown was born in Oldham in United Kingdom, has taken root in everywhere. Whichever country you go to now, they have the facility for assisted reproduction with in vitro fertilization and embryo transfer.
Okay.
So it's possible to the management.
Okay, go ahead, doctor.
Yeah, the management is very, very much with us.
Okay.
And if women are adequately managed, they can achieve a pregnancy, either with just tablets or release of adhesions, or diathermy to endometriosis, changing the position of the womb inside the pelvis, or diathermizing the ovaries. All this can lead to achieving a pregnancy.
There's a question that says, what is the solution to this? Imagine a woman has some swelling in his or her anus, and taking some injections, some antibiotics, yet the swelling is still there. Sometimes it goes, other times it stays there. And then after some time, it gets swollen again and causes severe pains, especially around the waist area. So that's a question for you, doctor.
Yeah.
It's there on the screen.
Well, it's
Okay,
to make a diagnosis based on this description. The diagnosis might not be 100%, but
Okay.
it's good for you to see, a qualified gynecologist who will examine you, check what exactly is in your back passage, and make a proper diagnosis and discuss the management.
All right. A lot of people are asking for the doctor's number. Don't worry, we'll roll it out in a moment. We'll just beg the PD to roll it out. Don't be shy. Don't be afraid, because a problem shared is a problem solved. There is no need to be shy. Nobody is going to stigmatize you. The matter of infertility is a serious one. So if you are experiencing any form of it, if you have a problem with this, call the doctor. We encourage you to call the doctor, okay? Nobody's going to recognize your voice if that's your problem. And if you think you don't want to call, do us a WhatsApp message, and you'll be happy you did. Now, doctor, let us look at this one now. You did say that the best time for a woman to make babies is 22.
Yeah.
But there are some women who get pregnant easily, even at 40 plus.
Correct. You see, we are all different, very different. And some women, they have lived a very pious life. They've not had multiple sexual partners. They've not had pelvic inflammatory disease. They've not had pelvic infections. They've not had human papilloma virus that predisposes to cervical changes, that predisposes to cervical cancer. So such women, they just get pregnant. And some of them make 8, 9, 10, 11 babies. So you cannot use those women as a prototype. What we use, what our prototype is a modern day girl in this city, who will be sexually active at 14 or 15, and by the time she's 18, she's had 4, 5, 6, 7 boyfriends, and because of this, she would have been exposed to pelvic infection, and this can damage the ovaries, damage the tubes, and damage the endometrium, because sometimes you have infection in the womb, and it causes Asherman's syndrome. So then the presence of human papilloma virus, the predisposition to cervical cancer, all these are all possibilities because of promiscuity. Then the other thing is that those who get pregnant would have had repeated termination of pregnancy. So with repeated termination of pregnancy, they are doing hazard to the cervix, to the uterus, by scraping it and scraping it and scraping it until they remove all the topsoil. If you plant on the stony ground according to the Bible, it's not going to grow. Okay. But when you plant on this fertile ground, it will yield fruits. Those are the things. So we need to go out and teach these young students, these young pupils, these young males and females, that if they must have sex, they should use protective sex. Even if you are taking combined contraceptive pill to prevent a pregnancy, you should also use a condom to prevent sexually transmissible diseases.
All right, doctor, we have this question that says that the lady says she's been pregnant. She lost the baby because, according to the doctors, the baby is not growing well. So the baby came out on its own. And after that, she discovered that she has plenty of fibroids. She was advised by her mother-in-law to go somewhere in their village where the fibroid came out after some concussion and all that. So now the problem is she is still where she was before all of this treatment. No pregnancy. What is she to do?
Yeah, I think it's unfortunate.
She gave birth to the fibroid, so she said. I don't know how she did that.
I do not know. Fibroid, the muscular tumor in the womb, I don't know of any herbs that can remove them. If there were, people would have known them. The only drug that we've been using to shrink fibroid...
We will not talk about drugs here.
The only thing we have used to shrink fibroid have been banned as we speak because they are very injurious to the liver. So that there are no drugs that are being recommended at the moment, whether medical or scientific, that you can use to remove fibroid. It's unfortunate that she's still pregnant. Maybe she never had a fibroid. She needs to see somebody who will examine her and determine what the problem is, so that she can have a way forward.
So, by and large, doctor, as we round off, management for infertility in one sentence, doctor.
When you think you have been having regular sexual relationship for a period of 12 months, if you are a young person, if you are less than 30, 28, 26, and you've not been able to achieve a pregnancy, see your gynecologist. Okay. If you have been having regular sexual unprotected intercourse for 6 months, and you are 35 years of age, or you think the doctor said your sperm count is not normal, see your gynecologist.
Okay, before we go, this question we want to answer it, doctor. Why is it that some men release during 2 minutes of intercourse hope this can be cured?
It's excitement. It's in the brain. So all you need to do is to do a little bit of foreplay and reduce excitement. Okay. You know, if you use alcohol to have sex, you find that it increases the excitement, it reduces the performance. So there's no need to use anything. Just be natural and have a normal sexual relationship. There are drugs to make you hang on for a long time, but those drugs are to be de-emphasized, because things should be natural. I believe in being natural.
So in conclusion, infertility, sterility, can it be cured?
Sterility maybe cannot be cured. Infertility can be managed.
Okay.
Yeah, it's not curing it, you're managing it. The infertile couple can be made to achieve a pregnancy if they follow the appropriate routes.
And if they see a doctor on time too.
Yes, seeing a doctor on time. Don't leave your childbearing to when you are 40, 42, after your PhD. No, after your BSc, make 2 or 3 babies, and you can stop.
Okay, the hot bath thing. You talked
the
about
hot bath. That's to do with temperature.
Okay, so men should avoid taking hot bath.
Hot bath, tight nylon pants, and all that. Yeah, these are things. A man around the house should use boxers shorts, you know, so that air can go everywhere. Okay. Because you need that area. You find that if you look at drivers, when they come to your clinic, you ask them, what job do you do? They tell you they are long distance driver. You see, the scrotal sac is between their legs, and they are sitting on that machine for 4 hours at a time without resting. Temperature rises. They are usually having low sperm count. Okay. So all these, you know, that's occupational hazard, which is unfortunate. Okay. So such a man, if he comes to you, we advise them, make your babies now if you are going to carry on with this kind of career.
All right, this is it on the program. We thank you so much for watching. Don't forget, the doctor is always available. You can give us a call after the program, and we might just send his number to you. Thank you for watching. Have a great day. Thank you, doctor.
It's my pleasure. Thank you very much for this one.
Nice.